Thank you to all three of you. Those were great individual and collective talks, and constructive. You know, we have a difficult discussion, but those were really constructive conversations. There's a mic in the middle of the room, so we're looking for Q&A. We have a half an hour. They were succinct as well. I want to just start it out. You know, there's a debate tomorrow night between two really smart men, and I wondered, what question might you ask, or what comment would you make if you were the moderator at tomorrow's debate? What point would you want to? And then we're looking for audience comments too. Yeah, speaking for yourself.
I suppose the comment I would make, although it applies beyond children's programs, is I would ask the candidates if we're not all into this together, and especially if we're talking about the budget situation, whether that doesn't mean we all have to join in to solve the problems. That means there are attempts to appeal to the middle class, as if the middle class doesn't have to contribute at all, are not correct. There are attempts to, or at least the attempt of one party to protect the rich is not right. The attempt of the other party to say the rich only can pay the price and get us out of this situation is not right. I would ask them if we're not in it all together. And if we are in it all together, what are they going to ask from all of us, from rich to poor alike? Even the poor, you know, there's this issue about, you know, what responsibility they might have within a program. I don't expect them to pay taxes. They don't have the money to pay it. So that's the question I would ask.
I'm not sure exactly how I would frame it, but I think there's been some research over the course of many of the political debates over the last year in the primaries, and there's been precious few, I think only one or two questions out of the hundreds asked that had anything to do with kids. So I think I would start with, haven't heard much from you about what you intend to do about children. What do you think the 5 most important things the president, and next Congress need to do to ensure that our kids are on a better path towards success?
I think what I would ask from a more broad budget point of view is ask both candidates how they see their work with Congress changing, in the sense that we've had a lot of maybe what some would deem failed policies. In other words, we had the tax cuts that expired in 2010. Did anyone, think about broader reform? They just extended them. We had, payroll tax rate reduction that was stimulative. It was just extended. We've had a debt limit fight that went down to the wire, came up with a policy that Congress basically now wants to get rid of. So how are you going to change the situation for the better, given that everything we do is so last minute and not well thought out, and we really need to put ourselves on a path towards developing something that is a real, genuine, long-term plan?
Hello, I'm Bob Reed with Healthy Teen Network. I always have a little bit of panic on these discussions because I get concerned about what about remediation and corrective. And I mean, we have young people, we have teenagers that aren't 16 yet and they aren't 0. And they're assumably going to live a long life. They could live a really long bad life because we've said, well, you're too old to be the 0 to 3 early childhood. You're not disconnected enough to fall into that. I'm curious how we enlarge. Plus, there's not a lot of evidence-based programming around crisis response. But we have people in crisis. We have young people who live on the street. We have abuse going on in households. We have a lot of stuff. Now, there is more evidence-based around preventive things in homes, but you kind of get my point. I can't picture a place that we're going to have such perfection that we aren't always going to have crisis youth. And how do we address that in this way where we're all saying, well, let's focus on the good stuff?
Yeah, so I'm glad you asked the question because it gives me an opportunity to underscore that was not at all my intent to say, let's not spend anything on the folks who are most vulnerable, most fragile in the midst of crisis. In fact, it's how we're responding to exactly those problems that give us the opportunity to identify resources that can be spent better to both resolve their problems as well as invest. So let's take an example. The child on the street. A relatively high proportion of them end up incarcerated. That incarceration is rather expensive. There are other approaches to a child who is disconnected to put them on a path towards connection, so that child's not left out, but the dollars that otherwise would have been spent on locking that child up can go into more prevention and early intervention, so there are fewer of them going forward. So I didn't mean at all to imply, after third grade, let's not fund fourth, fifth, sixth, seventh, eighth grade. We'll just skip over that, and then we'll start funding when we hit sophomore year. But rather, the way we're responding to the crisis child, the way we're responding to the crisis family, the way we're responding to lots of the toughest problems, in fact, has tended to be punitive, expensive, and ineffective. And if we're looking to identify resources, it's not a matter of just taking them away from those people. It's rather, let's have more sensible, humane, and effective responses to those very crises, which will free up dollars we can invest in prevention and early intervention.
I have a response. I think it involves some expense, but I think it actually pulls together the politics and the economics in a somewhat unique way. I have to start by indicating, as everybody in this room knows, we spend maybe 2 or 3 times as much on each of us as when we're elderly as when we're young. And I think we have to take some of that economic growth and start evening out that equation a little more. And one of the ways I would spend this money was instigated a tiny bit by the No Child Left Behind bill, which has all sorts of problems. But one thing it did emphasize was measuring progress. I don't know why we get report cards on attainment, not progress. So the teacher that takes a kid that can't read or speak English at all and raises that person 2 or 3 grade levels, but they still don't reach some level of passing, that teacher in that school is viewed as a failure in the current system, even though we do now have this somewhat of this progress measure. And similarly, the kid that's well above the standard of learning, there's no emphasis there. I go back a ways. I remember when we put money into the gifted and talented, and we put money into science, then we put money into the disabled, and then we put money, or impaired, then we put money over here now into this No Child Left Behind group. And what you can actually do is you could actually shift money around. This goes to the earlier question, too. You could shift money around from program to program, in every case statistically prove you've really done a good job in that program, but in aggregate you haven't done anything at all because you've moved up this group and just let this other group lag. I think the answer, and it would not be easy, but I think we need to think about individual plans that are individually based for every single child, trying to measure progress for every child and a plan for every child. And I realize if those teachers in this room who have to deal with the school systems where these individual plans are extraordinarily bureaucratic, they also mean you jump to the $30,000 level of help versus the $10,000. They cause all sorts of budgetary problems. So I'm not saying it's easy, but I think that's what we've got to do, measure individual progress for every child. And that brings along, by the way, the middle class, the rich, the highly educated, the less highly educated, because you care too. If your kid knows third grade math and they're teaching him first grade math, you care about his or her progress too. And so we shouldn't just keep emphasizing one group or the other. We should be emphasizing every child's progress. And then I think we get to Patrick's thing, because if you do that, if you're starting to measure that, you're going to invest where you get the highest returns. And that may well be the categories that he identifies. But don't sell it as we're picking this group or that group. Pick it as we're trying to measure and advance the progress of every child and figure out a plan for every one of them to the extent we're capable.
Hi, I'm Elizabeth Shore, Center for the Study of Social Policy. I have a question for Jean Sturley and Patrick McCarthy, related questions. Jean, you said that we should not be in a position where children's programs have to prove outstanding effectiveness. I want to know, how do we get out of that position? And Patrick, you were saying that the secret to scaling up is to bring together what we know about what works about effective practices and effective programs with effective systems change. How do we prove the effectiveness of something that is so complicated as bringing those two worlds together?
Well, Elizabeth, you're as much of an expert on this as we are, so maybe you should respond too. But I do a lot of work in budget and tax over time, and I find that one of the main ways to hold people's feet to the fire on this type of issue is to speak in relative rather than absolute terms. Now, I don't mean absolute terms aren't important, but let's say, if we have a certain amount of resources, say in the tax system or in the expenditure system, try to force people to say, okay, I've got this pile of revenues. How would you reallocate the budget? That's how we actually got tax reform in '86. We didn't talk about size of government. We actually even moved aside some of the distributional issues progressively. We said, how can we make each of these programs effective? And we dodged those other debates. And I think similarly, if you take the budget as a whole and you think of spending, is I would try to force Congress and the president to speak about relative terms. Is spending on the elderly versus the children better? That doesn't say I've got to prove spending on children gets a return of 20%. Quite honestly, the marginal spending on children has a negative return because it discourages us from work. So in terms of GDP production, it actually has a negative return. And so just shifting those types of balances or shifting the balance a little bit from, not from programs, it might be programs that fail to programs that succeed, but try to emphasize a lot the relative advantage. We do that a lot in our household, right? If you think about how you allocate your own budget, you really don't sit out there and say, gee, I got a 20% return from buying this piece of food or that. But you do make these relative comparisons. Gee, I think we'd like to have a little larger house, and so I'm willing to give up a little bit on what I'm spending on clothing. That's the way we often make choices. So it's not a perfect answer, Elizabeth, but I think making relative comparisons helps you win the battle. If you have to always have a higher absolute standard than somebody else, then you're in trouble.
So when I was thinking about Noah in the audience, I was really thinking about Lee Shore, the person who knows more than our collective rest of us about this. So Lee, my response to that, effective systems being combined with effective evidence-based programs, the measure really for systems are system outcomes, right? So just to take one example, we know with Casey's Juvenile Detention Alternatives Initiative, which is a system reform initiative, our average reduction in the sites in which we've worked, and we've worked in 165 jurisdictions, the average reduction in the number of kids locked up in detention is 45%. That's an effective system reform. If we can combine that kind of effective system reform with effective alternatives to detention, interventions for those kids who are arrested so they're less likely to get arrested subsequently, then that's what I'm talking about. It also is the opportunity to take the dollars saved by reducing reliance on detention by 45%, to take the dollars freed up in that way to invest in prevention and early intervention in the adolescent misbehavior category. So.
Yes, Mom. My name's Carolyn Dallas. I'm with the program here in the District Hall Youth Court. If I had the two candidates in front of me, the question that I would ask is that what is the common ground that you have regarding children? And then the second question would be, how do you identify and apply the multiplier effect in the budget cuts? And that would be very important to me because I'm involved in a program and I understand the budget cuts are necessary. But as a person with a sociology background, I'm continually concerned about we have to invest in our children. And so we need to invest on the front end versus on the back end when they're in prison. And so how do we make this a priority? Is this ever a priority when we're looking at the budget cuts? So that's what I would be interested in knowing.
Okay. I think they're nodding. We have a question here.
Good evening, and thank you, distinguished guest. My name is Elizabeth Kimvalakani, and I'm sorry to say I'm still in the incarceration situation. But I was wondering, I have this very strong notion that there is a conflict in terms of there's a battleground here that incarcerating children is a bigger business than putting money in terms of saving the children. Is that wrong for me to think that so?
A bigger business.
I happen to have a real strong opinion about about that. How long you got? The Casey Foundation is committed to closing training schools, so-called reformatories, that is, juvenile prisons and replacing them with something that works. This is not going to happen right away, but we're going to get that done. Exactly because if you look at recidivism, educational outcomes, employment outcomes, abuse in the institutions, future criminality, inability to form families, all the kinds of bad things that happen, those kids who end up going through incarceration as juveniles have rotten outcomes on all of those measures. And in fact, we know how to do better. We do know how to do better. Because of the huge amount we spend, not just in juvenile incarceration, but in adult incarceration as well, although it's not on the list for the feds, it certainly is on the list for states, it ends up taking money away from education and early childhood and other investments we could otherwise make. You know, it would be one thing if all of this investment in incarceration was making us safer. And of course, there are arguments to be had among the folks who research this stuff. But it's pretty clear, certainly for juveniles, and I would argue for many of the adults as well, that there are more effective, less expensive interventions when there's criminal behavior than locking folks up, and that we could then reinvest those dollars into things that work. So.
I just have a follow-up question actually for Patrick. In a lot of fields, incarceration is one of them. A lot of the money we spend doesn't actually go cash benefits to people. It goes through providers. That's a classic case. The money for incarceration all goes to the people who are providing the incarceration services. How do we set up an incentive system to get them on the side of what you're trying to achieve?
It's a great question. There's I'll make it even more complicated before I take a stab at an answer, which is that because these are mostly built facilities, there are sunk costs already there, right? So the marginal cost of putting one more person behind bars is tiny, right? Only if you close a whole wing or close the entire institution do you start to free up the dollars that are sunk costs into the institution. If you add to that the folks who are providing the services ranging from guards to others, then you've got lots of incentives to keep things as they are and disincentives to move on. Nevertheless, having said that, there are ways to have the folks who are providing the services be retrained to provide other kinds of interventions. That doesn't always work. You're still going to have a political battle. But if you look at, for example, juvenile incarceration in California, where the California Youth Authority 7 or 8 years ago was incarcerating somewhere in the neighborhood of 10,500 juveniles, and now it's about 2,500. If you have the political will, you can make it happen. We're seeing similar reductions in New York, in Texas. I mean, these are not easy states to work in. So this is a doable proposition. This isn't, it's one of the reasons why Casey's willing to say out loud, let's first shrink them way down, and then let's come up with different models for interventions. If kids do need to be in secure care, they ought not be in these facilities with 300 and 400 folks regimented the way that they are.
Hi, I'm Cliff Johnson from the National League of Cities. I think my sense about this conversation is in part that while we're having a conversation about how to spend money better, more effectively, et cetera, there's a large segment of the American population that's having a different conversation, which is about whether to spend money at all. And so you have this starve the beast effort and mentality that really is fighting over what share of GDP, what share of our national wealth or income is in the public sector versus in the private sector. So prompts two questions, one for Jean and Mindy about, doesn't it matter enormously whether we raise revenues that equal 16% of GDP as opposed to 20 or 22%, and how do you think about that? And for Patrick, when you're thinking about system reform, what do you do if you think the oak tree is dying or likely to die for lack of water down the road? So.
I think you hit on a really good point, which is that if you ask the average American, what do you want to cut out of the federal budget? They say, I want to cut international aid. Well, that's great. That's like 0.03% or something like that. I mean, it's so small. So I think when you sort of get down to that issue, it's just a matter of people thinking, well, the government doesn't help me. They don't do anything for me. I'm not on Social Security, disability. I'm not on Medicaid. So what am I getting from the government? And I think that this discussion kind of highlights, well, maybe people need to be more informed about if you drive on your street every day, who do you think pays for that? You drive, you send your kid to public school, who pays for that? So just kind of highlighting that more, to educating people more in that way.
I thought you were going to ask an even tougher question, like we haven't really even addressed what's going on in the cities, but but I'll take this somewhat hard question. I think a lot of the problem we have has to do with the extraordinary noise, of course, we have in our political system now, and the disinformation. I kept trying to point out in the numbers that actually most of these programs where we're spending a lot more are growing fairly fast. And so we have this disconnect that really affects programs for children. So when we cut healthcare spending from 5% growth to 4%, we call that a cut. When we try to bring spending, say, on education up to just inflation, we call that an increase. So it's really quite crazy the way we define cuts and increases, and the public, I think for the most part, doesn't understand this. I wrote a column recently, sort of castigating both candidates because in a campaign you always appeal to what you're going to provide for people, and so we tell the middle class they don't have to pay anything. From the left, they go after those with over 250,000. If you look closely at the numbers, it's about 1 to 1.5% of the population. Then from the right, we have this notion, well, the welfare exception given to the governors is hurt welfare reform. We're again talking about 1% of the population. I mean, come on. There's 98% of the population that have to be parties to this, and we just have to admit that to the public. I do think, and I hope, I may be wrong, that this situation is so serious that the next president, early in his term, I've even predicted, will put forward a major budget proposal. Whether he does it well, whether he reframes the debate to define it accurately, I don't know, because in the campaign they're not doing that. That's my hope.
And I guess not being an economist, and therefore I don't have to worry about how the water gets to the oak tree or whatever. I think I'm being hoisted on my own metaphoric petard or something. But I'm also sort of a long-term optimist, which is that at the point, I think for the first time, probably in 20 years, we are at the point of crisis. We're at such a point of crisis, and we're sort of forced to have to do something. I've heard different analogies, like when the pain of your tooth is worse than the pain of going to the dentist, you finally go to the dentist, and different kinds of analogies like that. But I think we are at the point where the combination of tax code reform, entitlement reform, and I couldn't go home and talk to my Quaker wife if I didn't say, we're not talking too much about defense spending reform in this conversation so far, which is the other big, Megillah. If you have Social Security, Medicare and Medicaid, and defense, these are the huge things. If we can correct the trajectories on each of those, then frankly, even at the margins, you free up lots of dollars to make investments in things that could have virtuous cycles. And see, that's where I'm kind of pushing us to think is it's not that we have to make huge investments in lots and lots of things in early childhood. We do have to make more investments than we're making now, but it's not, we're nowhere near what we're spending on Social Security and Medicare and Medicaid. We're actually talking just, some of that change trajectory between the tax code changes, so on the revenue side, entitlement side, and defense spending. Let's, in the midst of that, talk about, all right, so here's an opportunity to think about putting a little bit in the penny jar for the long-term good of the country here.
I just want to add a footnote. I think this is going to be at least a 10-year struggle. I've looked at past fiscal turnings when things were in dire situation, including, by the way, when the nation was first founded and we wouldn't even pay our troops in the Revolutionary War. It took 10 or 20 years to actually get through a lot of these compromises, and it could take as long this time. It's not. I don't think it's going to be a one-shot deal.
Hi, I think I'm the last question, and frankly, I'm a little nervous because I have gray hair. So, my name is Shirley Shantz. I'm from the National Association of School Nurses, and clearly we see an association between health and academic success and things like that. And so, to kind of end up, what can we do at the ground level? I mean, we're kind of talking about, making kind of big sweeping changes that will take a long time, but what can we do now and in the immediate future to make a difference?
I'll take a first crack at that. I think the secret is in what Jean was talking about a few minutes ago about the extent to which the average person really has misconceptions about what all these investment decisions mean. But as much as I'm a huge believer, as the Child Trends folks know, in data and research and studies, a few good anecdotes go a whole long way in your state legislature and in front of your school board, et cetera. And I think folks who are on the ground can marshal those kinds of stories and bring it home to folks and partner with the other folks who are doing more, large-scale data advocacy and policy advocacy. That's a very powerful combination. So you and your members know stories that you can bring to this debate.
Well, I want to say thank you, first of all, to our guests and for your stellar presentations. Thank you so much. Don't go anywhere, Chris. I want to thank the audience, all of you, for coming out today. And we want to say thank you to you by offering you two things that Chris likes. So, Chris likes to walk. She walks to work every day. A little backpack on, and she trucks on into work. So we're going to ask you to take just a very short walk across the hall to a reception. We are in a bicameral legislative building, so we're on the House side. We have a little H on here. To go over there, I think we have to have something that has a little S on it. Is that right? So we have staff right up front who will hand you a little thing that has an S instead of an H on it. So, so that's the first thing that Chris likes that we would like to offer to you all, a little walk. And it really is little. And the second thing, and I want to say this very carefully, Chris has been known to like an occasional glass of wine. Yes, that was the school nurse, by the way, clapping there, leading the applause. So we'd like to offer you a glass of wine or a softer beverage, perhaps, and some refreshments to say thank you for coming out today, and maybe we can continue the conversation that way. Thank you all. Thank you.